Good afternoon, everyone. Today we'll be focusing on a topic that affects many individuals, especially young people and college students like ourselves, and that's the effect of drugs and alcohol on mental and social health within college students. The intended audience for this presentation will be any college students struggling with drugs or alcohol addiction. Now, with that being said, we can dive into how drug and alcohol use is often discussed in terms of legality or physical health risks, but its psychological consequences are just as important. Through this presentation, we will highlight the connection between drug and alcohol use within college students. Our goal is to raise awareness about how certain substances, misused medications, and even alcohol at a regular party can have serious effects on your mental and social well-being, particularly during the critical years of your adolescence and early adulthood. Let's begin by taking a closer look at the research on how drugs can negatively influence mental and social health outcomes. We will begin with the impact of drugs on mental health. Moving forward, regular high THC cannabis use is linked to adverse mental health. Research notes an increased risk of depression for people who use cannabis heavily during adolescence. Studies also link cannabis use to higher rates of suicidal thoughts and behaviors in youth. At high doses, cannabis can induce temporary psychotic episodes, potentially contributing to later psychotic disorders. Also, students who use both prescription and illicit drugs reported worse outcomes than students who only misused one of these prescription drugs. The misuse of prescribed drugs can be dangerous for young adults. Example of these drugs can be opioids, Adderall, Xanax, marijuana, and even vaping.
One of the key factors to the effects on drugs can be seen and impacted on social health. The most common drugs used by college students are marijuana, ecstasy, LSD, Adderall, cocaine, painkillers, and opioids. In 2023, it was conducted that 2.4% of college students have non-medically used Adderall during college, 39.5% of college students have used marijuana, and men were more likely to use illicit drugs than females, which shows that college students are more prone and likely to be using drugs. Drugs are more commonly used by college students in social events due to peer pressure, trying to fit in, or used as a relaxant to feel at ease in social settings. So, this ties in to my last bullet point, which is college students are more likely to use drugs due to availability, such as easy access to them, and overall experimentation and trying new things. So I believe that students who are encountered with peer pressure are more likely to do drugs because it's being offered to them and available. And it's college students usually, students try new things, which is why college students are more likely to do these drugs. And there have also been studies conducted that show that Greek life, fraternities, and sororities are more likely to binge drink and misuse substances.
On this slide, I want to address a critical issue affecting students nationwide: the detrimental impact of substance use on cognitive function, attendance, and academic motivation. Cognitive and memory impairment. Substances like marijuana and prescription stimulants can significantly disrupt cognitive functions. For instance, marijuana use has been linked to short-term verbal memory deficits, although these effects may diminish after cessation. Conversely, misuse of ADHD medications such as Adderall and Ritalin can impair brain plasticity, affecting memory and complex learning capabilities, especially in young individuals. Poor attendance and tardiness. Drug use can lead to regular tardiness and absenteeism. For example, binge drinking the night before school can make it challenging for students to arrive on time, disrupting their learning and academic performance. Studies have shown that students who engage in substance use are more likely to skip school and have lower attendance rates, which can negatively impact their academic outcomes. Reduced motivation and interest in learning. Drug users often exhibit a diminished interest in classwork and a negative attitude toward education. This lack of motivation can lead to lower academic achievement and increased dropout rates. Students who engage in substance use are at a higher risk of achieving poorer educational attainment, experiencing reduced academic performance, being truant more often, and having lower academic engagement. In conclusion, the evidence is clear. Substance use can have a profound negative impact on students' cognitive abilities, attendance, and motivation, leading to poorer academic outcomes and increased dropout rates. It is crucial that we address this issue through education, support, and intervention to help students succeed academically and lead healthy lives.
Alcohol and social health. Heavy drinking is often normalized on campuses, influencing students to drink to fit in. Many students might feel pressure to drink at parties or social events to feel accepted or liked. This pressure can make people who don't want to drink feel like outsiders or push them to drink more than they're comfortable with just to fit in. Risky behaviors. Alcohol impairs judgment and increases the chances of unprotected sex, fights, and accidents. Alcohol lowers your inhibitions and clouds your judgment. This can lead to risky decisions like having unprotected sex, getting into physical fights, or driving under the influence. Relationship tension. Frequent alcohol use can lead to conflicts, miscommunication, and loss of trust among friends or partners. Frequently drinking can create problems in friendships or romantic relationships. Someone who drinks a lot might become more argumentative, forget important conversations, or behave in ways that hurt others. Academic and career issues. Missed classes and poor performance can lead to academic probations or job opportunities affecting peer status. Drinking heavily may lead to missing more classes, having more late assignments, and poor focus, which will affect your grades. Isolation. Heavy drinkers may withdraw from non-drinking peers or feel alienated over time. As someone becomes more involved in heavy drinking, they might stop hanging out with their friends who don't drink, or they might feel out of place if their drinking habits cause tension with others. This can lead to loneliness and a sense of disconnection. Legal and disciplinary troubles. DUIs, fights, or policy violations can damage reputation and lead to social stigma. College students who drink heavily may face arrest for underage drinking, DUIs, or violence. Getting caught can result in fines, suspension, or even getting kicked out of school. Besides the legal issues, having a criminal record or a school violations can seriously damage one's social image and future opportunities.
I want to talk about something that often gets overlooked when we think about our mental health, and that's the impact that alcohol plays. While it's commonly used in social settings and seen as a way to unwind, the truth is alcohol can take serious tolls on our mental well-being. To start off, alcohol can cause significant mood changes. It often leads to mood swings and irritability. In fact, people with alcohol disorders are 3 times more likely to experience depression than those without it. Alcohol not only worsens symptoms of anxiety and depression, but it can also trigger them in the first place. Many people use alcohol to help them relax, but in reality, it interferes with our sleep quality, which only adds to our mental fatigue and emotional distress. Studies show that alcohol consumption is directly linked to an increase in sleep disorders, leaving individuals more likely to experience irritability, fatigue, and reduced cognitive functions during the day. It also impairs our judgment. We've all heard about the consequences of decisions made under the influence, whether it's unsafe behaviors, arguments, or moments of poor judgment. In fact, alcohol is a major factor in risky behaviors, like accidents and even violence, contributing to the fact that around 25% of people who die by suicide have alcohol in their system. For those already dealing with mental health conditions, alcohol can make things even harder. It can interfere with treatment, worsen symptoms, and make recovery feel like an uphill battle. People who experience a mental health disorder are more likely to face severe emotional distress, and breaking free from the cycle can feel nearly impossible. Alcohol puts immense strain on our relationships as well. The next time we think about how we care for our mental health, let's not forget the role alcohol plays. We need to recognize that while alcohol may provide temporary relief or moments of relaxation, the long-term effects can have lasting impacts on our mental health.
In wrapping up our discussion on the dangers of drug and alcohol use, it's clear that these substances can have profound negative impacts on our health, relationships, and future aspirations. We've explored how they can impair judgment, lead to addiction, and cause long-term physical and mental health issues. Remember, the choices we make today shape our tomorrow. By staying informed and making conscious decisions, we can protect ourselves and those we care about from the adverse effects of substance abuse.